are still not well understood. What we do know is that regeneration after pH requires division only of mature liver cells over a few days without recruitment of stem cells or hepatic progenitor cells. What we also know is that after pH, multiple cascades of growth factors and cell cycle regulated events and processes occur in a well-coordinated manner. Studies with whole animals, as well as cultured cells, point to crucial roles in hepatic DNA synthesis of cytokines in addition to growth factors. In particular, based on studies with knockout mouse models and cultured cells, it is generally believed that without the cytokine TNF-alpha, liver regeneration will be impaired. However, cytokine-mediated inflammatory responses are typically deleterious and are best eliminated in most cases. And this raises conundrums about their biological roles in liver regeneration. Let me illustrate this point about the deleterious effect of inflammation on hepatocytes. For instance, that related to ischemia reperfusion following liver surgery or even cell transplantation. Previously, we reported here how such inflammation rapidly activates an enormous cascade of cytokines, chemokines, and the receptors in the liver. Illustrated here in this table. Now let's talk about these individually. No, just kidding. The point I wish to emphasize is that cytokines such as TNF-alpha or IL-6 are damaging to hepatocytes. This was illustrated further by cell transplantation studies using etanercept, a TNF-alpha blocker in routine clinical use. In cell engraftment assays and also liver repopulation assays, where DPP-4 rats were preconditioned with a combination of retrosine and partial hepatectomy, which blocks proliferation of endogenous hepatocytes. We'll come back to this in my study shortly. So compared with controls on top here, animals pre-treated with etanercept prior to hepatocyte transplantation showed far more liver regeneration, liver repopulation. TNF-alpha expression was clearly not good for cells. And that led us to ask, our hypothesis was, will blocking TNF-alpha with etanercept prior to partial hepatectomy benefit liver regeneration? To answer this question, we set out to, 1, determine the consequences of ETN pre-treatment on pH-induced liver regeneration. 2, to establish what would be the biological effects of ETN on hepatocytes in remnant liver after pH. And 3, to consider the mechanistic basis for alteration in cells after liver regeneration with ETN pretreatment. Broadly speaking, we performed 2/3 partial hepatectomy in Fisher rats with or without ETN. Controls received saline. Time course analysis was done. To analyze the effects of ETN on cells in the long term directly, we isolated hepatocytes 2 weeks after pH with culture or cell transplantation. Gene expression changes were examined using QRT-PCR arrays with a total of 168 genes. Now the results. First we asked, did ETN interfere with recovery or liver regeneration after pH? By examining survival of animals and liver to body weight ratio 2 and 3 days after pH, if ETN was deleterious, outcomes would have been worse. However, we found no differences in mortality or morbidity. Grossly, liver appeared normal in both groups. At 72 hours, liver was actually larger in ETN recipients, suggesting greater regeneration. Therefore, ETN appeared to be beneficial rather than deleterious. If liver regenerated better in ETN recipients, we should have seen more cell proliferation. After pH, substantial fractions of KS67 positive hepatocytes appeared, as expected. However, Ki-67 expression was far greater after ETN, a remarkable increase. These were nearly twofold greater after BH in ETN-treated rats. So surprisingly, ETN was beneficial rather than deleterious. Then we asked, would cells isolated from ETN pH condition be more robust? As I indicated earlier, cells were hepatocytes isolated 2 weeks after pH. The viability of primary hepatocytes from control, pH, and pH plus ETN was not different. After culturing cells for 24 hours with CCL4 followed by MTT, hepatocytes from the pH donors showed greater resistance to injury than healthy controls or ETN plus pH cells. With microgenic stimulation, with EGF, ETN plus pH donor cells showed more Ki-67. We asked, would cells isolated from ETN pH condition be more capable of proliferating in vivo? In DPP4 negative rats, hepatocytes from pH donor engrafted less than healthy donors. In recipients preconditioned by retrosine and pH, ETN plus pH cells repopulated liver faster than even healthy donors or healthy donor cells. Transplanted cells were in discrete foci, resulting from 1 to 2 transplanted cells each. Liver was repopulated least by pH cells. This difference in liver repopulation kinetics was substantial. In one of the analyses, we quantitated the area occupied by individual transplanted cell foci. These areas were plotted with minimum, maximum, and quantile distribution. That's the chart on top. In recipients of ETN plus pH donor cells, the distribution of transplanted cells in the third largest quantile of 75% or more, that's the green line, was greater than either healthy donor cells in brown line or pH donor cells, orange line. These transplanted cell foci contain up to 500 or more cells. The data here established that ETN plus pH donor cells underwent more population doublings. Since each transplanted cell focus arose from 1 to 2 cells, and the time for cell proliferation was also known, we were able to determine the number of population doublings. ETN plus pH donor cells has divided up to 12 times, which was 2 or 4 times more than healthy cells or pH cells. This difference is actually enormous, given the fact that liver regeneration after pH requires only 2 to 3 population doublings. Finally, we focused on potential mechanisms. With carbon phagocytosis assays, we found ETN did not decrease Kupffer cell activation. Nonetheless, gene expression was different. In ETN plus pH livers, multiple genes were downregulated, including chemokines and receptors. ETN normalized growth suppressors like P10 or IGF-P4 and increased expression of genes in survival pathways such as the IL-6 mediated JAK-STAT3 signaling. So let me summarize. The specific anti-cytokine drug-based approach successfully elucidated the role of TNF-alpha in pH-induced liver regeneration. The role of TNF-alpha in liver regeneration was deleterious and not beneficial. Prior blockade of TNF-alpha with etanercept improved liver repopulation kinetics with major benefits on engraftment and proliferation of transplanted cells sourced from donor liver after pH. In conclusion, these benefits of ETN will be significant for people undergoing liver resection as well as for donor organ preparation and cell or gene therapy. Thank you.
Thanks very much. Do we have any questions? questions from the audience? Maybe I should ask one, since I'm one of the people that reported that blocking TNF was bad for liver regeneration. So we did that with an antibody, and then Nelson Faustos, followed up with TNF receptor knockout mice. So how can you reconcile these different results? Have you tried another strategy to block TNF? I'm just wondering if the TNF-R1 knockout had inhibited regeneration, and then you find TNF inhibition stimulates regeneration. How can we explain both of those things?
Well, this is a great question, and that when we use knockout of receptors instead of pharmacological blocking of the actual molecule, the results will be different. I assume that knocking down the receptors will create a TNF-alpha storm that will actually result in more TNF-alpha, and that would actually account for the conflicting results.
How would it work if there were no receptor, that you had more TNF, there was an effect?
Blocking TNF-alpha as a molecule will be different from actually knocking down the receptors.
I blocked it as a molecule with an antibody, I got a different result. So I think it's interesting you got what you got. So I think what we have to do now is we have 3 different results. We have to try to understand how to explain the differences in the models. And so I wonder if you have thought about that.
One other thing that could also account for the discrepancy is that there are 2 forms of TNF-alpha, the soluble and the membrane map, that could also skew the results from the
Yes, Michael, please introduce yourself.
Jonathan Fowler, Edinburgh. That's interesting. I was actually going to ask a similar question to you, so I've got to think on my feet, something different now. What would you do next? I mean, I'm just thinking about the translation of this. How do you want to take this forward? What's your next study?
We'd like to complete the work we already started by. What we're currently doing is we're building a bigger transcriptome analysis to see what genes are affected by TNF blocker set. That will give us a more complete picture as to what is happening after we block TNF-alpha. If that answers your question.
Any concerns about sepsis or normal wound healing?
This we haven't looked at, but this could be something that we would look at in the future for sure.
I was wondering about things. You give the TNF of a blocker, but you haven't really shown either TNF going down or its downstream signaling going down. Do you have data on that?
The data we have from gene expression shows massive downregulation of cytokine, of mainly chemokines and chemokine receptors. There are also other genes in the signal transduction genes that were also affected by TNF-alpha blocking. But again, we have to wait until we do the whole transcriptome analysis before we can draw results.
Was it just a single treatment before partial?
It was a single injection of etanercept 1 day before partial ectodermy.
Do you know the half-life of it?
The half-life of etanercept is 3 to 4 days.
So you think it will be in circulation?
Absolutely.
Have you checked for it?
No, we haven't, but this might be something we should do.
I think we have maybe one more question, then we have to move on.
So James Thomas from Brisbane. You showed a slide showing that there was no change in cryptopsil activation, but was that macrophage numbers or actually changes in behaviour, like phenotypic differences?
No, what we tested was actually the activation of Kupffer cells. It's the phagocytosic aspect of Kupffer cells, and that showed no major difference.
I suppose it's only one sort of phenotypic characteristic of the cell type.
Yes.
data on gene therapy?
Yes. For gene therapy, blockade of TNF-alpha would be something that could be applied in its context. So the possibilities are endless here. Probably Dr. Gupta will be happy to elaborate more on that.
But I'd love to do it later because we're running out of time. Okay, thank you very much.
Thank you.
Okay, our next talk is role of phagocytosis in coordinating dead cell clearance and regeneration of the injured liver by